We have made our presentation regarding the principle of Plasmalipo at the Spring Conference this year. Today we ask you to listen the idea of handpiece for the safety procedure to the clinical usage. Lipolysis by the laser was introduced to the medical market with an expectation of sufficient efficacy without a liposuction. However, in fact, the effectiveness is lower than what we had expected, and that is realistically often used with a liposuction. As we have already introduced in our previous presentation, Dr. Schaefer in San Diego in the West Coast of America has modified its output from 6 watts to 10 watts and the fiber from 300 micron to 400 micron diameter. Plastic surgery, in particular of cosmetic surgery area in the United States, liposuction is a top common and popular surgery beyond the breast surgery. But this is a big operation and the heavy downtime lasts long time, especially big BMI American patients, as well as the doctor's stress is high. This is the picture of presentation in lipolysis confession held in the spring of this year in Las Vegas. We felt the American doctors are interested in the laser lipolysis more than Japanese doctors. The relative machines that we suspect hardly made of wavelength with high energy output, from various manufacturers, are also being introduced to the medical market. This is a scene of lipolysis operation. The operator in the movie moves handpiece back and forth. An often observed the edge of the handpiece pushes up the skin, then make a triangle like an Egyptian pyramid. So there are two worries about this procedure. The output of the machine in the movie was 24 watts. It is very high power, but it does not burn the skin. Is the machine supposed to be generating a sufficient enough energy to melt down the fat? If the energy is enough, there are the possibilities of a skin burn or necrosis. Can we expect to get enough results without the skin burn? The thickness of fiber on the most of machine are around 400 microns. We could predict that the fiber could be broken during the operation and it might remain semi-permanently inside the body. But fortunately, the diameter of the fiber is 1.5 millimeters in this movie, so it wouldn't be broken easily. We have made our presentation regarding the principle of Plasmalipo at the Spring Conference this year. If we explain in very short summary, left side picture is the end edge of the laser fiber that is being generally used, and right side picture is the end edge of Plasmalipo fiber like a shape in half dome with specially treated to microscopical polyhedron. A laser light has an intrinsic character of straightforwardness to deliver the energy to the far direction in front. It does not interfere the lateral directions. Whereas the laser light delivered to the inside of the Plasmalipo fiber is bumped to the treated surface and repeats complex scattered reflection to lose its coherency. Accordingly, when the light moves outward, it expands in every direction of 360 degrees and melting down the fat touched by fiber. A monochromatic laser light loses the intrinsic characteristic of straightforwardness, then expands and spreads out. The light is moving circle after passing through the surface in shape of half dome. As the picture has shown, the laser light transforms into 500 nanometers 800 nanometers of broadband visible rays. This plasma light itself is verified as the heat wave. The temperature in the center is over 2500 degrees Celsius when it lights in the air. But, as it is distinguished from the laser, it expands in every direction around, and the temperature at the point of 2 millimeters away from the fiber end in a pig fat is limitedly increased up to 80 degrees Celsius. This movie shows that we have emitted laser light and plasma light at a same set of energy output in the white of an egg. On the left of laser, the light just passed through the white of an egg, but the white of an egg touched by the fiber end coagulates in the plasma light on the right. It is very concerned that the high possibility of skin burn or necrosis when the fiber comes near just in touch to the dermis if its energy is strong enough to melt down the fat. So, there we created new handpiece for Plasmalipo. This is the cannula. This is a head part of handpiece. And this is a body part. The cannula covers whole of fiber when the operator pushes the head by his or her thumb. The fiber remains in the cannula with no light emitting when moving it forward. And a fiber comes out of the light emitting cannula when release the head of handpiece backward. Left corner is the close-up of front edge. We could observe that a fiber inside of the handpiece moves back and forth. Now we show you a safety simulation test on the pork fat. Plasmalipo is developed and distributed by the name Plasma D3980 from Gyces. This machine is compact to carry by hands. This is a simulation moving cannula back and forth in the pork fat. Moving forward by pushing the head part of handpiece forward, then a fiber goes inside of cannula. A forwarding resistance to the cannula is low in a fat layer, but it should be stopped when it moves towards to dermis because of increased resistance. Then the operator exposes the fiber from the cannula and pulls back the cannula with emitting plasma light, so the operator can eliminate the skin burn. Do you hear this fat melting sound? You could hear the sound of a fat melting, and you can also hear the same sound in the operations of real live human body. Plasmalipo operations are preceded by local anesthesia without any sedation involved. So patients are able to hear this fat melting sound. Patients will be very surprised and pleased if you explain it to them. Fats in your body are being melted. If the operator moves handpiece forward with emitting plasma light is same as the common laser lipolysis procedure, we are sure it burns the skin because of very powerful energy. This time, move the cannula forward with exposed fiber emitting plasma light, preceded by melting down the fat, and the cannula moves forward without the resistance. When the cannula touches the subdermis, and it pushed forward, the plasma light might burns the skin. When moving a cannula, cover up the fiber by cannula without emitting the plasma light in opposite. When moving a cannula backward, release the head of handpiece towards to its body and emit the plasma light. If you keep doing this way, there are no worries about making any burn. Even though the blood vessels are coagulated not to bruise after the operation. From now on, the movie shows you a scene of immediately after the operation. A friction between a cannula and a skin is small, because of using cannula here is proceeded in slow speed compare with the conventional laser lipolysis. And the damage on inserting area of the skin is also small. There are 3 sizes of the cannula at the moment as 20 gauges for the facial, 18 gauges for the limited area and 17 gauges for the wide area. Post-operative scar formation is minimized using these thin small size of cannula. The operator can check the fluid melted fat comes out from this small puncture hole immediately after the operation and show the patient it. Here I list conclusion. If the energy were really strong enough to melt the fat tissue on the light-assisted lipolysis treatment, we will have very high risk to skin burn or necrosis. Plasmalipo is a broadband strong light source system that expands in every direction of 360 degrees and melting down the fat, coagulating the vessels touched by fiber. We introduce and safety in a Dowd fiber mechanism built-in handpiece for Plasmalipo. One more information. Dr. Minami will show clinical before-after results in the afternoon. Please visit the presentation. Thank you for listening.